Good evening. Thank you for attending the webinar tonight. I'd like to begin by acknowledging the traditional owners and custodians of the lands and waterways from which we are all zooming in from today. We recognise their diversity, resilience and the ongoing place that First Nations people hold in our communities. We pay our respects to the elders, both past and present, and I wish to extend that respect to any First Nations people connecting in today. We commit to working together in the spirit of mutual understanding, respect and reconciliation. We support self-determination for First Nations peoples and organisations, and we'll work together on closing the gap. My name is Helene, and alongside me tonight is Jade, and we are the Workforce Development Officers at the PHN. I'd like to welcome everyone here to our Women's Health webinar series, and this is session 5, preconception health. A little bit of housekeeping. The majority of our webinar events are recorded and freely available on our PHN Learn YouTube channel. Jade will put that link on the screen at the moment. We have a practice communique that we send out to practices fortnightly with valuable information, including internal and external calendar of events. You can also subscribe to the Westvic PHN fortnightly newsletter via our webinar. Please note the Westvic PHN health pathways relating to this topic that is on the screen at the moment. For this evening's meeting, may I ask participants to remain on mute for the course of the meeting. Should you have any questions, please type them in the questions box and your questions will be answered during the course of the meeting. I will answer them on your behalf and they will be anonymously asked. Our speaker for this evening is Dr. Karin Hammarberg, who is a registered nurse. I will now hand over to Karin. Thanks, Karin.
That was my prompt to show my screen. So let me just get that sorted. And I should start from the beginning. Sorry about this. There we go. I'm very sorry. Thank you very much for attending today, and good evening. And I really do hope that this presentation will answer any questions you have about why preconception care is important, who needs it and when, and how we can best provide it. So I am Karin, and I am a registered nurse. So I have a clinical background, but the last probably 2 decades actually, my clinical background was mainly in infertility care and in IVF clinic management. But in the last 20 years, I've been in academia, and I've done a PhD on women's experience of IVF treatment. And I now work at Monash University as a senior research fellow, but I also work for the Victorian Assisted Reproductive Treatment Authority. And that's a statutory authority. And one of its obligations is to actually educate the public and have about infertility, fertility, and how you can prevent infertility. So as part of the VARTA remit, we have federal government funding to run a program called Your Fertility, which is a fertility and preconception health promotion program. And a lot of the resources I'm going to refer to today are part of the program, the Your Fertility program. And at the very end, I'll take you to a little guided tour through the website, so you can have a little look at where you can find hopefully very useful resources to for yourselves, and also some to share with your patients. So my starting point for this presentation is the so-called Red Book, which I'm sure you are all very familiar with. It states that preconception care is a preventive activity, and that every woman of reproductive age should be considered for preconception care, and that this consists of interventions that aim to identify and modify biomedical, behavioral and social risks to a woman's health or pregnancy outcome through prevention and management. Well, that's a pretty big statement, and it's a very big ask because, of course, while it might be possible to identify many of the biomedical and social risk factors, modifying them is of course much harder. But there are certainly some behavioral risk factors that we can help people modify. So why is preconception health so important? Well, it's because genes are sensitive to the environment, and they can change how they function if they're exposed to suboptimal conditions. And these changes in genes in response to the environment are called epigenetic effects. And some epigenetic changes can affect the health trajectory of the offspring. We've known for a long time, of course, that epigenetic changes can occur in fetal life in response to the environment in the uterus. So, for example, if a pregnant woman smokes or if she is undernourished, this does increase the risk that the baby is smaller than expected at birth, and this in turn increases the risk of poorer health in adulthood. But now we know that conditions even before and at the time of conception also affect the short and long-term health of offspring. And this includes the environment where eggs and sperm mature and the composition of the fluid in the fallopian tube when fertilization takes place. So in addition to the genetic material that parents contribute to their offspring, their actual condition at the time of egg and sperm maturation and at conception, they really do have lasting effects on the expression of the genes and the health of the future child. And because of the profound effect of parents' health before conception, we do need to integrate preconception health promotion in our practice, because most women and men want children and they expect to become parents sometime in their life. And of course, they hope that they will have a healthy baby. And while there is a lot of promotion about how important it is for the health of the baby that mothers look after their health and adhere to certain health behaviors during the pregnancy, like not smoking, it's really becoming increasingly clear that both parents' health, even before conception, can affect the health of the baby at birth and into adulthood. And we know from population data that about 35% of pregnancies are actually unplanned. So this doesn't necessarily mean, of course, that they are unwanted, but because they just happen, parents don't get the chance to optimize their health before they conceive. So this really points to the need for pregnancy planning. And I think the primary healthcare professionals are really well placed to help people understand this. And we also need to remember that about 5%, and that's 1 in 20 births in Australia, is a result of assisted reproductive technology like IVF. And with IVF, a lot of planning goes into trying to have a baby. And this really means that there is a great opportunity to ensure that people are as healthy as they can be before they conceive, because this will not only make sure that they give their baby the best start in life, but it will actually also improve their chance of achieving a pregnancy and a birth with IVF treatment. So when is preconception? Well, if we think about it, for fertile people who don't use effective contraception, this is any time during the reproductive years, because we don't know until after the event that a woman is pregnant. And that's why the US-based Centers for Disease Control and Prevention, they recommend that everyone as part of primary care visits is provided with a risk assessment, educational and health promotion counseling. They say that this is for women, and I have added in brackets and men, because I think it's important we include men here as well. So all the women and men of childbearing age, to reduce reproductive risks and improve pregnancy outcomes. For people who use IVF, it's a bit easier to know when the preconception period is and to advise them that they should try to optimize their health and avoid factors that are known to be risky in pregnancy, certainly in the months leading up to the treatment, if not sooner. Now, the idea that every primary care consultation should include discussion about preconception health might seem impossible, but there are certainly some types of consultations that really lend themselves to opportunistically starting conversations about the importance of optimizing health before trying for a baby. So, of course, any reproductive health consultations, like pap smears, people come for contraception or STI checks, but also general health checks and when people come for immunizations before they travel, I think they're good opportunities to kind of pop the question about pregnancy intention. But we also do know from the literature that there are many barriers for routinely asking people about pregnancy intention and for providing preconception health advice. So the ones I've put up on this screen, they are from a systematic review on this topic, and they really broadly fall into 3 categories. So the evidence that they reviewed shows that some practitioners don't think it's part of their role to discuss preconception health. And this is especially true for those who are not in the obstetrics and gynecology fields. There's also evidence that some practitioners don't feel that they know enough about it. And it's generally thought that there's a lack of clarity about who is actually responsible for preconception care. There are also barriers on the patient side, including that most don't see a healthcare provider before they try for a pregnancy. There's also some evidence that some think that there's no need to see a doctor before pregnancy, and presumably that might be because they're not aware of how important it is. And lastly, there are of course several organizational and societal barriers. The most common ones identified in the review were that practitioners really lack time, and that's quite understandable considering the time pressure that everyone is under. But also the lack of tools and guidelines, and of course the lack of reimbursement were other barriers that were identified in the literature. In terms of the Australian context, as part of my work with the Your Fertility program, some colleagues and I have surveyed primary healthcare professionals about their knowledge, attitudes and practices relating to promoting preconception health. So we have surveyed primary healthcare nurses, maternal and child health nurses, and also general practice GPs about in 3 different studies. And what they actually show, altogether these studies are very similar kind of findings from the 3 studies, and that's that most primary healthcare providers, they really think it is part of their role to promote preconception health, but they don't do it routinely. And some of the reasons for this is that they do worry about bringing up the subject because they think it might be sensitive. There's also some that feel that they don't know enough about it. And over the 3 studies, everyone was calling for more education and more resources to share with patients. So having looked at all the things that make it hard to promote preconception health, what might enable practitioners to be more proactive about asking people whether they plan pregnancy, and then talk to them about the benefits of optimizing health beforehand? Well, firstly, there is evidence that people actually don't mind being asked about their pregnancy intentions. I'm going to tell you a bit about that in a minute. Then there's clearly a need for educational resources and trustworthy information to direct patients to. And I'm going to tell you a bit about that too, what is currently available, because there's quite a bit out there to help practitioners integrate preconception health promotion in their practice. So, based on the findings of a study that we conducted a couple of years ago, practitioners probably don't have to worry too much about asking about pregnancy intention and thinking that it's a sensitive subject. Because we surveyed a nationally representative sample of more than 700 people of reproductive age. We asked them a whole heap of questions about their knowledge and attitudes and behaviors in relation to fertility and having kids and preconception health. And one of the questions that we asked was, how would you feel if your GP asked you if you were hoping to get pregnant in the next 12 months? And what we found was that almost 3/4 either said that they wouldn't mind or that they would actually appreciate it. In terms of educational resources for health professionals, there are some excellent ones out there. I highly recommend Dr. Edwina Dorney and her colleagues' papers about pre- and interconception care. They're open access from the Australian Journal of General Practice, and they offer a great overview of the benefits of preconception care and also about the evidence to support the need to integrate questions about pregnancy planning in consultations with people of reproductive age. And you'll find reference to these papers in the reference list, so you can look them up anytime you like. There are also by now at least 3 online learning modules relating to preconception care, and they're all endorsed and accredited by professional organizations, and they give CPD points to those who complete them. So one of these online learning modules has been developed by Jean Hales, and it's described on their website the aim of it is described to be to improve health professionals' knowledge and understanding of fertility, preconception health care, and infertility. And that the webinar will provide an overview of fertility awareness and preconception care, the causes of infertility, and indications for specialist referrals. So there's quite a lot packed into that webinar, online learning course. The another one, it features on the Healthy Males website, and Healthy Male used to be known as Andrology Australia, and is a health promotion website specifically for men's reproductive health. And this one is described as covering the sensitive topics of supporting fertility and preconception health with your male and female patients. And lastly, the Your Fertility team collaborated with APNA to develop an e-learning module to improve the capacity of nurses and midwives working in primary health care settings, improving their capacity to promote preconception health. And now it gives me great pleasure to tell you that as part of the Your Fertility program, we have a range of resources and information for you to direct your patients to. And I'll take you through a little guided tour of the website later on, so I can show you these in more detail. But all of these resources are evidence-based, of course, and they come in a range of different formats. There is the interactive Healthy Conception tool, and this one has a section for women and one for men. And this is where they input their personal information like their age and height, weight, alcohol consumption, smoking, etc. And then they get personalized advice about each factor and how it might affect their chance of conceiving and having a healthy baby. At the end of filling out all these fields, the user can print a detailed summary of the information, and then there's a call to action to take this to a GP for a preconception health check. So this tool is available on the Your Fertility website, of course, but we were also contacted last year by Medibank because they had found it and they liked it. And after some negotiation, they have now replicated this tool on their own website. So on the Your Fertility website, you can also find plenty of other resources for people who plan pregnancy. And there are checklists and fact sheets and videos and links to other websites with trustworthy information. Now to the clinical practice tips that I think are really important. So in this work, we were inspired by the One Key Question initiative, which was developed in the US. The people who led this initiative, they noted that, and I quote, "The importance of preconception care to improve maternal and child health outcomes is becoming more evident. More women who are choosing pregnancy are older, struggling with chronic medical conditions, and taking medications regularly. A preconception care visit can optimize their chances of a healthy pregnancy by screening for conditions that adversely affect pregnancy and reducing toxic exposures to the infant." So on the basis of this, they suggest that primary health professionals routinely ask women, and again, I suggest that this should apply to men as well, they suggest that they ask women who are in the reproductive age range, would you like to be pregnant in the next year? And if the answer is yes or maybe, this is the opportunity to invite the patient to come back for a preconception health consultation to make sure she or he is in the best possible health before trying for a baby. And if the answer is no, this does allow the health practitioner to discuss the need for reliable contraception to avoid unplanned or unwanted pregnancy. And if they don't already have it, to invite patients to come back to discuss contraceptive options and refer them to a family planning clinic. I actually really like this approach because the question is simple and non-judgmental. It's really not saying whether people should or shouldn't have kids. And it's also the patient's response that guides the advice that's offered afterwards. So using this one key question idea, we have developed some resources for Australian practitioners, and we kind of call them planting the seed, and that's supposed to refer to the proactive approach to planning pregnancy and preventing poor pregnancy outcomes. So there is a guide about how to ask about pregnancy intention, and that's clearly modeled on the one key question, and then how to advise people depending on their response. But more importantly, we produced 4 short videos to demonstrate how this can be done in practice and how little extra time this adds to a consultation. So I will show you a couple of those videos at the end. But there's a male and a female GP, and each ask a young woman and a young man about their plans for pregnancy. And this is all in the context of different types of consultations. So it's not really providing preconception care, but it's just flagging to people that they should come back for a health check if and when they plan to get pregnant. The guide also has a summary of the things to cover in a preconception care consultation. And this one is drawn from the papers I mentioned earlier by Dorney and colleagues. But as you can see, it's quite a bit to cover, but I thought I just would talk a little bit more in detail about 4 of the most important preconception health risk factors. So obesity is the most common clinical risk factor for the development of high risk and complicated pregnancies. Many factors contribute to obesity, including a person's family history, their eating habits, and levels of physical activity. And everyone's familiar with this. But there are also a lot of factors, of course, in the environment that influence obesity rates, like the ready access to processed food, fast food and sugary drinks, and the reliance on cars for transport. People who are overweight or obese, they often feel bad about this. And in part, I think this is because of the stigma attached to obesity. The sad thing is that feeling judged or stigmatized, discriminated against or pressured by others, that in itself can cause behavioral change that leads to more weight gain. Obesity affects reproductive health in many ways. It can cause hormonal changes that interfere with ovulation and reduce a woman's fertility that way. And that's why women living with obesity, they take longer to conceive than women in the healthy weight range. And they're also more likely to experience infertility. And this is actually true for women who are underweight as well. Obesity can also lower male fertility, and this is likely due to a combination of factors, including hormone problems, problems with erection, and perhaps also other health conditions that are linked to obesity. Apart from the adverse effects on fertility, you'll be aware that many pregnancy complications are more common among women living with obesity than among women in the normal weight range, including neural tube defects, preterm birth, diabetes, cesarean section, high blood pressure, and blood clotting problems. There was actually a recent population-based study that showed that the rise in the prevalence of obesity in the last 25 years in Australia was associated with increasing rates of adverse maternal and neonatal outcomes, particularly gestational diabetes, macrosomia, and preeclampsia. So I'll go back one here. So parental obesity can also cause epigenetic changes that predispose the child to obesity and all its related health problems later in life. So these are very long-term intergenerational health risks. And it's important for couples who need IVF to conceive to know that the data actually is clear that obesity does reduce the chance of achieving pregnancy with IVF and increases the risk of miscarriage. So Judith Stevenson in the UK is one of the very strong proponents of the need for universal preconception care. And in a recent paper, she and her colleagues state that, and this is quite a long quote, but I think it's worth reading. So the rise in obesity among women of reproductive age has been the most pressing wake-up call to improve preconception health. And she mentioned that obesity affects over 1 in 5 women in the UK, and I think that's the same in Australia. And that this is strongly linked to almost all adverse pregnancy and birth outcomes. And she goes on to list some of those, but unfortunately, she says, attempts to tackle the problem through diet and physical activity interventions starting in pregnancy have had negligible effects on immediate and later outcomes. So the conclusion of all this is that she says that together, these findings call for a new focus on improving health before conception. But bringing up the topic of weight can be very difficult, and there are many studies that show that health professionals don't feel really very well equipped to do this. But because the consequences for pregnancy health are so great, it's really important that we do try to discuss it. And when we do, I think it's better to emphasize the benefits of weight reduction. rather than the risks of obesity. So trying to put a positive spin on it. There is of course no silver bullet for weight loss, but some of the necessary ingredients for achieving sustained weight loss are the environment, an environment where health professionals and family and friends provide encouragement and support rather than blaming and shaming. People need achievable weight loss goals and a realistic time frame to reach the goals. They need knowledge about nutrition and healthy eating. Of course, they need access to fresh food, and not everyone has that. And they also need the means to increase levels of physical activity. I just recently read that the word obesity is a much hated word by people who struggle with their weight, and that they prefer that we talk about how they can get into the healthy weight range. It's also useful for women to know that even a modest weight loss does improve fertility and pregnancy health. Also, if they haven't been able to lose weight before pregnancy, it's good to know that some dietary and lifestyle interventions that limit pregnancy weight gain, they can also improve outcomes for both mothers and baby. Now, when it comes to trying to lose weight, a recent study showed that men and women are twice as likely to make positive health behavior changes if their partner does that too. So doing it together. So for couples who are trying to get pregnant, really encouraging them to work together to increase physical activity and lose weight, that will improve their chance of achieving weight loss and also, of course, a healthy pregnancy. Alcohol use is another factor that needs to be addressed in preconception care. The NHMRC guidelines are clear about what the best option is for women who are trying for pregnancy. But it's also important to not let the men off the hook. And there is a message there from what's called the FASD Hub Australia. And this is a government-sponsored source of high-quality evidence-based content about alcohol and pregnancy. They say that we just don't know if and how alcohol might damage sperm, and that it's therefore best for men to avoid alcohol in the preconception period. Now, the evidence about the harmful effects of alcohol on offspring is mounting, and we now know that even modest amounts consumed during pregnancy can cause fetal alcohol spectrum disorder. And this is described by the FASD Hub Australia as the diagnostic term for severe neurodevelopmental impairments, which result from brain damage caused by alcohol exposure before birth. And this is a lifelong disability that happens already in fetal life. FASD Hub Australia, they have lots of evidence-based resources for health professionals, if you want to look for some. And there's another organization that's called No FASD Australia, and this one is funded by the Department of Health. They have actually launched an evidence-based interactive online learning resource, which has 7 modules, and they each take about 20 minutes. And at the end of that, there is a downloadable certificate if anyone is interested. There's also some, quite striking kind of health promoting images produced by the Foundation for Alcohol Research and Education. They make this very strong point about the importance of not drinking in the preconception period. And now to smoking, which we all know is harmful for general health, but which also has very adverse effects on fertility, pregnancy health, and the health of the baby. It also reduces the chance of having a baby for those who need IVF treatment. So it's worth knowing that it's also worth knowing that passive smoking is almost as harmful for reproductive health as active smoking. So I could, of course, go on and on about the terrible health effects of smoking, but it's important to focus on the benefits of quitting rather than the risks of continuing when we talk to patients who smoke. And the good news is that the effects of smoking on eggs and sperm and fertility, they are reversible. Whether it's the male or the female partner or both who smoke, quitting will increase the chance of conceiving and having a healthy baby. There is, of course, no safe limit for smoking. The only way to protect the smoker and the unborn baby from harm is to quit. But quitting can be difficult and people may need support. There are a lot of resources out there to help people quit. So directing smokers to these and then making sure that they have regular contact with a supportive GP can actually help people across the line. And again, I think people who are planning to have IVF, they are particularly receptive to messages about what they can do to increase the chance of success. So if you have a couple where one or both partners smoke, they should be vigorously encouraged to stop. And if they both smoke, doing it together will increase the chance that they quit for good. And just a few words about the importance of supplements in the preconception period. And I'm sure you're all very well aware of this, and that if it started at least a month before conception, daily folic acid prevents 7 out of 10 cases of neural tube defect, which I think is a pretty profound statistic. Iodine is also recommended from preconception throughout pregnancy and breastfeeding. And there is some limited, I have to say, but there is some little bit of evidence that zinc and selenium might improve sperm quality. So particularly with folic acid, pregnancy planning and knowing to start taking it before trying to get pregnant is key to getting the full benefit of taking it. And just to finish up, I'm going to tell you about 2 studies that were looking at women's preconception health. The first is from the UK, where Judith Stevenson and her colleagues surveyed more than 1,000 women who were pregnant, and they talked to them or surveyed them about their preparation for pregnancy. What they found was that more than a quarter of pregnancies were unplanned. Only about half of the women took folic acid preconception, and 1 in 5 smoked, and more than half consumed alcohol in the months leading up to pregnancy. About half actually saw a health professional before their pregnancy, and it was interesting to see that they were more than twice as likely than those who didn't to take folic acid and to adopt a healthy diet. So this really shows the impact that preconception health advice can have. The second is a study of women in Australia conducted by Callaway et al. They surveyed just over 400 women in early pregnancy, and the findings were pretty similar to those in the UK study, with only about half having a preconception health check and taking folic acid before they conceived. Close to 1/3 of the women were overweight or obese pre-pregnancy, but almost half of them actually lost some weight before the pregnancy, which was encouraging to see. But interestingly, of the women with the BMI in the obese range, very few categorized themselves as obese. Whether this is because obesity has become normalized because it's so common is hard to know, but it does reinforce the point about the complexities of obesity as a public health risk. So to end, I would like to quote from Dawnie and colleagues, because I think this really sentence summarizes the whole talk I've just given. So she says that the critical first step is screening women. And again, I have to put in and men, because that's I'm onto that all the time. We have to include the men in all this. We can't leave all the responsibility to women. But the critical first step is screening women for their pregnancy intentions and initiating conversations about optimizing health before conception or discussing effective contraceptive options. So here's just a slide with some of the very useful resources that you can access on the Gene Health website. They have e-learnings and webinars and all sorts of other booklets and tools relating to women's reproductive health. So I thank you all, and there will be these 2 slides with the references which you can access. And I will try to now get the website up and see if I give you a little tour of the website. Maybe I should ask the host whether we want to do questions before we do the tour, or whether we should proceed with the tour now.
Hi, Karin. We don't have any questions coming in yet. So if anybody has a question, feel free to start typing while Karin starts the tour of the website.
Okay. All right. So can I disappear now? Oh yeah, I have disappeared. Okay. I hope you can see my screen.
You can see that perfectly, Karin.
Okay, good. All right. So this is Your Fertility homepage, and again, I'll just reiterate that this is funded by the federal government, and it is a really a kind of one-stop shop for any information about fertility health, preconception health, infertility prevention, and really, hoping to reach people on all sorts of levels about, how we can protect fertility and make sure that pregnancy outcomes are as optimal as they can be. So on the menu button, we can go to general resources and find all sorts of things, including fact sheets, and that's kind of the classical kind of way of providing information, but these are very practical and very accessible, and of course based on the best possible evidence. So there is a lot of different factors if people are interested in them. I'll just scroll down here so you can see. And at the end, we also have quite a few resources. These are specifically for Aboriginal and Torres Strait Islander young people about, the looking after your health before you before conception. There's also quite a few. I like this one from Healthy Male, which is about how to look after your sperm. And then there's quite a few. This thinking about having a baby, which has got all the ideas about what you can do to optimize outcomes. We have those in quite a few different languages. So if you have women who don't have English as a first language, there are quite a few resources in different languages that they can access. So that's the kind of that's the fact sheet part of things. And when you go to videos, you'll see just from the titles that there's a lot of personal stories, which I think are quite powerful. This one in particular, she describes the kind of changes she made and her husband made in preparation for pregnancy, and really just to give their daughter the best start in life. We have health professionals talking about the whole idea of parenting actually starts before conception. Professor McLaughlin, who is a male fertility specialist, he talks about the importance of men's preconception health. There's a lot about smoking and why we need to stop that before. It's just there's a lots of them here, but you can just go and have a look, and some of them are from just personal stories and others are from experts. But there's quite a smorgasbord of videos there. And then we have these, what I mentioned before, the interactive tools. And there's an ovulation calculator. This is the healthy conception tool I mentioned. And it just, people have to decide, whether they do it for a woman or for a man. And then there's questions on 2 pages. And then at the end, there is a summary that can be printed and taken to a GP for a discussion about preconception health. So we can also then look at this section, which is for professionals. And this is where we put together just resources to help health and education professionals also talk about. So there's a whole thing on fertility for teachers as well. But to talk about fertility and embed it in conversations about health. And again, we have the preconception health learning module that we developed with APNA. And here is this planting the seed resources that I mentioned to you. So it comes with this diagram that I mentioned. This one, really just the basics about how do you ask this question, and what can be the potential responses, and how would you then advise the patient. So that's that one. And then we have, I'll just try and show you 1 or 2 of these videos. So we can start with, maybe this is a male GP. He's going to talk to a patient who might want a baby in the near future. Let's see if this works. Let's hope.
I do have a question that's come in, Karin. Do we know much about the uptake and offering of carrier screenings in brackets SMA-fragile XS-CF.
Sorry, I had a bit of trouble hearing that question because I had the video running. What was the question?
Oh, sorry, Karen. Do we know much about the uptake and offering of carrier screening with preconception consults in terms of stats?
Yes, so I don't actually know what the uptake is, but I do know that it is you know, obviously moving into the field, and people who are keen on preconception advice, they're probably more likely than others to access this screening. And I think there is, at least for some diseases, it has now become refundable by the government. Am I correct? You probably know more about this than I do. I think at the moment the take-up is not, you know, universal by any means, but I do think that it's something that become more and more common.
Thanks, Karen.
So can I keep playing this video?
Yeah, sorry, I didn't realise you were playing it.
Karen, we actually don't have any audio coming through on the video you're playing, hence why Helene didn't realise. We can't hear it, sorry.
Aha. It's a bit strange because I thought you could hear it through my... Okay, well, if it doesn't work, it doesn't work. You can go on the website yourselves and read. They're short videos, and they're really just a demonstration of the kind of, you know, how easy it is to ask a question, and that it really doesn't need to add a lot to the time it takes for the consultation. And I'll just see if there's anything more useful here for health professionals. So we've got all these, and then there's also a lot of fact sheets. And again, these are videos more for health professionals, and they can be, you know, people can use whatever they need. So that's my little tour of the website. And you know, apart from that, I think if there are other questions, I'm happy to answer them.
I do have another question, Karen.
Yeah, good.
Alcohol and pregnancy. Is there any benefit to potential mothers to stopping alcohol before starting to try for a pregnancy? And if so, how long before?
Well, it's a tricky question, but I think it is, because the thing is that from fertilization till a woman realizes that she might be pregnant, a lot happens in that little embryo. And again, exposure to alcohol in that critical first 3 weeks of pregnancy, which obviously pregnancy starts around about ovulation. So you don't even know that you are pregnant. And therefore, that's why I think it is important to talk about avoiding alcohol even before pregnancy is confirmed, because the pregnancy might be confirmed maybe a week or 2 weeks after a missed period, and by that stage the pregnancy is already 4 weeks old, and a lot has already happened in the development of the embryo and the fetus. So that would be the rationale for stopping or trying to stop. I think it's a fine line, because I don't think shaming and you know, making women feel guilty about everything they do is not very helpful either. So we have to tread carefully, but I think sound advice is that, if possible, avoid alcohol while you're trying to get pregnant.
Thanks, Karen. I don't have any questions. We do have a little bit of time if anybody wants to quickly write a question in the question box. But I would just like to take this opportunity to thank you, Karen, so much for your talk. We're so fortunate to have expertise in your area. For our attendees, please don't forget to fill out your evaluation sheet. And if there's any other women's health topics, pregnancy care related, any other topic not related to women's health, please pop them in there, and we'll see if we can get them done this year. I know I'm doing some pregnancy care series this year, so you may have some topics there that you might like to hear. So pop them in. But if that's all, I do not have any more questions, so it's always nice to finish a little bit earlier.
Sure.
So thank you, Karin. If you've got nothing else to add, I will finish the webinar.
Thank you so much. Thank you.
Thank you again. Appreciate it. Bye, everyone.
Bye.